to introduce her to you. Katie currently leads public health intelligence partnerships at the WHO Hub for Pandemic and Epidemic Intelligence here in Berlin. She originally trained in medicinal chemistry and completed a PhD on chemical weapons at the Harvard Sussex program. Since 2010, Katie has held diverse roles at the World Health Organization at global, regional, and country levels, primarily focused on emergency preparedness and response. And she had actually worked with the team, Kwame and Hannah, who you saw in a previous panel before in Syria. So over to you, Katie, now for the facilitation of the pre-launch of the Lancet Commission report.
Thank you very much, Karina, and it's always embarrassing to hear your bio read out in front of you, but I'm aware that worse than a fate of a session before lunch, we're hosting the session before the drinks reception. So I hope we can keep your attention and be lively and stimulate some discussions that you'll later have or already having over your glass of wine. We're really privileged to have a set of distinguished speakers here this evening for this pre-launch event of the Lancet Commission on One Health, an eagerly and anticipated report that we'll hear more about. The structure of the session, we'll hear a couple of speakers present some scene-setting presentations, and then we'll move into a moderated conversation between the two co-chairs of the Lancet Commission. I'd like to introduce our speakers, who are standing ready and waiting on the left-hand side of the room. First of all, Dr. Tania Rödiger-Vorwerk. Tania is Deputy Director General at Germany's Federal Ministry for Economic Cooperation and Development, BMZ. I'm sure you all know it very well. There she leads the Directorate for Global Health Resilience, Equality for Opportunity. Over the last 25 years, Dr. Vorwerk has served in various leading management positions, both in the public and the private sector. And some of these have included directorates for environment, energy, and infrastructure, and also she has advised the SDG agenda at the global level. Our second speaker will be Dr. Fairouz Larfaoui, who is an animal health officer at the UN Food and Agriculture Organization, FAO. She has been a focal point for the global Quadripartite Secretariat on One Health at the FAO, and she has over 2 decades of experience working on animal health across sectors, across partners, governments, and has devoted her time to really lead and advance One Health from the FAO. We also have with us our two co-chairs of the Lancet Commission. First of all, Professor John Amuasi. John is the head of the Global Health Department at the Kwame Nkrumah University in Ghana. And there he leads the Global One Health Research Group at the Kumasi Center for Collaborative Research in Tropical Medicine. He also holds a professorship of Global One Health at the Bernhard Nocht Institute. And for over 2 decades, he's engaged in areas of research around tropical medicine, global health, including malaria, neglected tropical diseases, AMR, and One Health. He serves as one of the co-chairs of the Lancet Commission on One Health. And finally, our last presenter and speaker this evening, Professor Andrea Winkler, professor of neuroscientist and neurologist, specialist neurologist, and co-director of the Center for Global Health at the Technical University at Munich. She holds several other professorial positions, one health at the University of Oslo, and also brain health at the Harvard Medical School. She applies these varied specialisms to the application of communicable, non-communicable, and zoonotic diseases. And she is the second co-chair of the Lancet One Health Commission together with Professor Amuasi. So, to kick us off, I'd like to turn to Dr. Rödiger-Vorwerk to provide some perspectives, specifically from Germany, on the growing need for a One Health approach, especially given the currently changing global landscapes. So please, over to you.
Good evening. Good evening to this very special event. Ladies and gentlemen, distinguished guests, dear colleagues, dear friends. To be honest, I'm a little bit excited because this is a very special moment. It took some time to set up this report, and I'm very proud to be part of this year's Global Health Talk. So I'm really happy to present and celebrate today the pre-launch of the report of the Lancet Commission on One Health. So you all know we are at a critical juncture across the globe, health budgets, and I know this very seriously at the moment. Health budgets are shrinking, and long-standing commitments, long-standing cooperations erode. Nevertheless, our joint effort towards achieving the SDGs is still there, but it's really at high risk. But every crisis bears opportunities, and this is an important moment to reconsider global health to make it fit for future. Thinking beyond 2030 and make it fit for future for political communication also. This is why we in the BMZ, we are actively engaged in current processes on reforming the global health architecture. Health is not just a personal matter, as we all know, it is the backbone of global security, economic resilience, and human dignity. And health, and that I'm happy to reassure you, health has been a key priority in German international cooperation for many decades across various consecutive governments. And in the face of these numerous challenges we have and crises, we still stay committed. And even despite tightening budgets, Germany, as my minister said at the Gavi replenishment in Brussels, Germany stays trustful in working in global health. At the Gavi event, we have pledged 600 million euros, and this was very different to many other donors. So it was a common effort in our ministry to stay reliable and have the same numbers as in the last years. So we know, and it's almost in every speech, it is estimated that in the next 25 years, a pandemic similar to the scope of COVID-19 is more than 50% likely to occur. And in the past, the source of most pandemics, we think, was a spillover of a disease from animal to humans. Today, almost 60% of infectious disease occurring in humans are zoonoses, which means that they were transmitted from animal to humans. And climate change and intensive livestock farming and the spread of human settlements make pandemics more likely. And in the light of this, the need for effective pandemic prevention, preparedness, and response is greater than ever. And this is where One Health approach becomes essential. The One Health approach recognizes the interdependencies with human, animals, and the environment and the environmental health. So with this, One Health is not an additional sector or activity. It is a mindset, a way of how we plan and implement interventions. And to be honest, I'm working in this field with global health for 3 years. And I would be happy if in 10 years I could say, looking back, there is more interconnectedness between the constituency working on animal health and the constituencies working on global health. This is something which I see and which makes me nervous, because I'm in both areas working, and when I go to conferences, there's no mixture. It's either the one or the other group. but take it away, this, what I'm thinking about, and thinking about how you can do this in your own work field to do it better, because it's not only about speeches, it's also about really making it to reality and bringing the budgets where this cross-cutting work is done. So the core of the One Health approach lies in this cooperation, communication, and the coordinated effort across the different disciplines and sectors, and then it allows us to spot and seize win-win opportunities, like protecting wildlife while lowering the risks of spillover of pathogens from animals to human or vice versa. The relevance of the One Health approach is also reflected in the recently adopted pandemic agreement. And I know that in these rooms are some people who have been negotiating this agreement, and give them an applause, because this is really something which happens not that often. And these are in this room, these people who have done it. So thank you, because it is an amazingly important step. I'm a lawyer, and I know the first step in an international agreement is always to have a contract, and then working on it. And this is what the colleagues are doing for the moment to make it more concrete, more binding, and this is what it is about in the next years. So let's see, the German Ministry of Economic Cooperation and Development, the BMZ, has a long-standing commitment to promoting the One Health approach, be it in development cooperation or through support of the Quadripartite or the Global Health Initiatives as the Pandemic Fund, which we have been one of the founding partners. So let me give you at the end one example for our cooperation with the East African community. We supported the establishment of the regional expert pool from EAC countries with stakeholders from different sectors, including human and animal health and environment. These experts can be deployed to assist countries in case of an outbreak by joining forces across sectors and borders. And the most recent example of the successful approach is the response to last year's outbreak of Mpox, Ebola, and Marburg disease in East Africa. With the support of the German Epidemic Preparedness Group, the so-called SEEK, experts from the EAC region were trained on detecting and treatment of, difficult word, hemorrhagic fevers. Okay, you all know what it is, I don't know, and contributes to the fast containment of the outbreaks. So, at the multilateral level, we support the Quadripartite in the development as well as the ongoing implementation of the One Health Joint Plan on Action, and the collaboration on One Health comprising WHO, FAO, WOAH, and UNEP, together with the One Health high-level expert, OLEP, you all know this, has been instrumental in advancing the One Health agenda and has provided a robust foundation for addressing zoonotic diseases, antimicrobial resistance, and pandemic prevention. So in our work in the ministry, we are guided by scientific evidence and the insights provided by experts, which we have here today. And therefore, we are deeply grateful for all the experts of Lancet One Health Commission and their hard work. I have met them 2 years ago, and now it's done. Excellent. We are very much looking forward to learning more about the findings and recommendations of the Commission today, and the official launch, probably you all have got an invitation, virtually July 17th. That's next week, and the report will undoubtedly provide us guidance in the ministry and other institutions how to spell out our work and the roadmaps for the next years. Thank you so much.
Thank you so much, Deputy Director General, and thank you to Germany for its unwavering support. Even though it might not be the easiest thing, but keeping health high on the agenda is something that is most critical right now. Thank you also for reminding us that the key to getting some of the opportunities out of this crisis is to unlock the connections and to break down the silos that exist amongst us. So one way to do that has been through the establishment of the Quadripartite Secretariat. And now we're going to turn to our colleague from the Food and Agricultural Organization, Dr. Larfaoui, to take us through some of the quadripartite opportunities and challenges in the implementation of One Health. So over to you.
Thank you. Good evening, everyone. So first of all, I would like really to thank very much the Global Health Hub for inviting me being from FAO, but on behalf of the Quadripartite here present. So it's really a great honor to be here present, and it was really, until now, very, very interesting sessions. Thank you for this. So the presentation I'm going to, as it was mentioned before, it's a presentation to give you a bit an overview on how the four organizations, the Quadripartite, work together, and to give you a bit some information on the progress we have made in terms of advancing One Health at global, regional, and national level, and also highlighting also some challenges and also opportunities regarding the advancement on One Health. So, but before that, I would like to emphasize the OLEP definition. So you have heard before by Dr. Tania Rödiger-Vorwerk, who mentioned the OLEP, the One Health High-Level Expert Panel. They have released in December 2021 this definition, which is quite, would say, very inclusive, and it is endorsed by the four organizations, I would say welcomed by the four organizations of the Quadripartite, and also embraced by the international community. And an important point also, it is referenced in the latest approved pandemic agreement. And we can see this at of the World Health Assembly, so we can say that it is a great achievement. So this definition is not just about zoonosis, it's really an integrated, unifying approach to sustainably balance, and it is and optimize the health of peoples, animals, plants, and ecosystem. It recognizes that these health domains are closely interlinked and interdependent. And what is really important is that it recognizes the health of humans, domestic, wild animals, plants, and the wider environment, including the ecosystem, and also to highlight again the fact that it mobilizes multiple sectors, disciplines, and community at varying levels of society to work together to foster well-being and tackle threats to the health and ecosystem, and addressing in a cross-sector, in a cross-cutting way, the climate change, food safety, clean water and air, and sustainable development. So this is just want to highlight the importance of this definition, which shows the importance of collaborating. And this morning and today, the whole day, we have heard the word collaboration, which is absolutely key, and we cannot work alone. And this is also a sentence that I heard during the day, which is very important. So regarding the collaboration between the four organizations, I'm not going too much into details, but we have actually a governance mechanism with different levels in this governance. And here I want to highlight the highest one, which is where the four principals of the four organizations meet once a year during the Quadripartite Executive Annual Meeting, and they decide and agree on the priorities for the next year. And here I want to highlight the one very important point in the implementation of the One Health Joint Plan of Action that has been also mentioned before. Importantly, the strengthening One Health science and evidence, enhancing the political engagement and advocacy, and of course also the resource mobilization. Why this? I mean, this was also priorities of last year, and it was emphasized to continue in this direction. This is one of the priorities which consisted really in advocating and also at political level advancing One Health. And here I want to highlight in the different areas where we have been really very much engaged. So first of all, to highlight the fact that we have been, and this was also mentioned before, the Quadripartite has been very much engaged in the international negotiating bodies and the pandemic agreement. And we have actually chapter 5, Article 5, that really emphasize on One Health. And here the Quadripartite has been very much engaged together in also interacting with members on this. And we had also One Health group of friends, which was very, very much, engaged on all these activities to move ahead and to have it and to advocate for it. Secondly, the Quadripartite have been very much also engaged in the UN General Assembly and present in the high-level meetings on pandemic prevention, preparedness and response, and on AMR. In these two events, this helped also to include One Health into political declaration. Another important, where also Quadripartite have been particularly engaged, it was in the G20 and G7 events. And here also in high-level meetings, also contribute to the to side events during this events, and also in contributing and supporting ministries in the development of the declaration, including also policy brief. Lastly, the environment that I did not highlight before, the importance on the environment, and this is where UNEP actually joined in 2022 the Quadripartite. Before we were called the Tripartite, and this is very important as well, our engagement in terms of Quadripartite in the UN Conference of Parties. Also here where we have been also in the UN Climate Change Conference, and also the one on biodiversity, and which helped really also to contribute also to the Global Action Plan on Biodiversity and Health. So this is now talking about implementation. So the Quadripartite have been, and it was mentioned before, very much engaged in, has developed the framework of the One Health Joint Plan of Action that we have presented it in several occasions. It was launched now, I would say, it was, I think, in 2022. And then we have developed to provide further guidance to the countries on how to develop their national action plan, a guide, an implementation guide, and this this with the 4 organizations. So, and this guide has a stepwise approach and along 5 steps. It's really, a very flexible guide. It consists really in conducting situation analyses, in establishing national multi-sectorial One Health coordination mechanisms, in supporting also in countries in developing their national action plan and developing their priorities. Priorities was also very much mentioned today. The priority activities, the costing of these activities, and finally also the importance also to be able to monitor also the advancements of the implementation on One Health. And here also OLEP has played an important role in also reviewing the documents, and also in developing what was very important in developing an inventory, a database giving access to One Health operational tools. Not in developing new tools, but in helping, in guiding countries on the use of existing tools that also the 4 organizations, but also other institutions have developed to advance on One Health. And we have also resources and also templates to help on that. Now, I want to just share with you some examples where we have been actually proactively working together, the 4 organizations, at different levels. So at global level, we work very much, as I mentioned before, framework, developing guides. And we had also in the last, it was also very much under the WOAH chair, because just to highlight now, the chair of the Quadripartite is under FAO. So developing, we had some workshop really to hear lessons learned from different realities on some national workshop, regional workshop, and we tried to understand what were still some gaps and so on. So we had virtual meetings, hearing from experience of National One Health Joint Plan Action workshop about situation analysis, and monitoring and evaluation and learning. And this helped also to meet also recently, last month, we met in Rome at headquarters in FAO, the 4 organizations will really discuss on a joint methodology to have an harmonized approach really when helping countries at country level. When helping countries in advancing One Health, and we are together at country level. Regional, we have organized already 3 regional workshops with having ministries from agriculture, health, and also environment present. And we had one in the Eastern and Mediterranean region, one in Asia Pacific, and also one in European region. This regional workshop are extremely useful because we bring really all the ministries together, and the Quadripartite is also here, and we learn. I mean, it's really an exchange platform where we hear from the ministries, and also where we bring our tools and experience and so on, and in guiding also on when there are some requests of support. We had also some experience of a national workshop in terms of operationalizing One Health in Kosovo, Bangladesh, South Africa, Bolivia, Cameroon, and you can see another number of countries, Bangladesh, Bhutan, Pakistan, and so on. And we will have also another 2 in the next few months that we are going to conduct among the 4 organizations. So this is to show you some experience that we are having together in the ground. And now it's to share with you. I think this is really important to share with you because this is where we learn from the recommendations that come from this regional and national workshop. Because what is really important is that, I mean, the needs come from the countries, and we are there only to support in advancing. So what came up is that the importance to establish and strengthen One Health coordination mechanisms for collaboration across the sectors. So this is absolutely key, and partners and donors. Important also to develop a strategy and engage all One Health players, including indigenous people and local communities. Engage also the environment sector in One Health initiative, including in the implementation of the One Health Joint Plan of Action. So this is really what was strongly recommended. Emphasize and encourage One Health in the education. I mean, this was also mentioned today. So I see that there is really a good alignment. Promote the use of one operational tools without developing new tools, but again saying, taking advantage of using what exists and make these tools complementary rather than inventing always new tools. They leverage resources and provide technical support to countries to adapt and implement One Health plans. Conduct high-level advocacy as what we are already doing for policymakers and politicians, so to continue in this effort. Develop sustainable financing mechanisms for implementing various One Health actions. And also here we have heard about this financial crisis and looking for new approach. And this is something that also is regularly discussed now at the UN level. And organize also annual One Health meeting. And I think, this is also regularly happening. Yes, I'm trying to be fast. I don't know why we don't see the text, but this is not a problem. Just to highlight, we talk about financing crisis and so on. The Quadripartite has developed a part of the Quadripartite Resources Mobilization Strategy, a joint offer. It's an advocacy document that calls for a targeted One Health investment to support this national uptake of One Health joint plan of action. And the idea is to plan some roundtables and also with bilateral roundtables with bilateral partners and multilateral development bank to mobilize resources for One Health implementation and leveraging existing funds and initiatives and so on. So the idea is really, in this place we want to highlight, is to highlight the importance of having ownership also from countries, really shaping in a different way the investment and looking for sort of domestic funds. This is my last slide, just to mention, this is a great hub. FAO Quadripartite is also supporting some interesting community of practice. And I will bring in our organization the importance of this hub to join it. And I think there could be a lot of win-win. We have community of practice on One Health governance, community of practice on return on investment. These are led by the Quadripartite, but there are many others that also are led, organized by FAO or led by FAO. This is not a problem, but this is very important because these are communities that allow to have countries presenting their experience on One Health implementation. We bring different topics, and I think this is really a great opportunity, and I can give you the details to have access to these communities. And of course, I'm highlighting the importance here of OLEP, which is an important panel which helps us to advance in One Health. Currently, OLEP is also conducting an inventory of One Health relevant international legal instruments, and finally provide more guidance. The idea is that they will help to provide more guidance on the use of One Health operational tools. Sorry if I'm a bit late. Take-home message, last one, to continue. So it's really essential to prevent pandemics, ensuring food safety, reducing AMR, addressing environment issues and the triple planetary crisis, ensuring no countries left behind, continue with functional and sustainable One Health governance at country level, offer tech for the Quadripartite to offer technical support to countries, and continue with the intersectoral collaboration, which is vital to advance in One Health. Thank you very much.
Thank you very much, Dr. Larfaoui, and for highlighting the needed agreement and support of the principles all the way through the expert committees and down to implementation at the country level. So, before we switch to drinks, now I would like to invite our co-chairs of the Lancet Commission up to the front. Maybe we can have some water glasses here. Please join me. I will get rid of these bottles. And let's turn to the Commission's report, something that we're all very, very excited about and want to hear more of. To kick us off, you got started in 2019. It seems a world ago. So what was it in 2019 that drove you to set up this commission? What were the current issues at the time that propelled this commission into being? And what was it set up to do? Maybe Professor Winkler, I will turn to you first. You just need to press on that little button and take us
Thank you
on
so
the
much,
journey.
Katie. Yeah, it's a pleasure to be here. And John, it's just an immense pleasure to do this with you. We've been together now for such a long time. And in fact, how did it happen? It was by serendipity, which is a nice word. I love it. Accident, maybe more blatant. Richard Horton came to Oslo when I was in Oslo, when I was the director of the Center for Global Health at the University of Oslo, and he heard us give a talk about One Health. And he said, oh, that sounds interesting. And One Health was not really super popular then. It was a niche. right? And then I needed a super duper counterpart. And of course, there is no better counterpart or the one part than John Amuasi from Ghana. And I reached out to him, and we had a full year, 2018 that was, a full year of negotiations and how we delineate ourselves, or how we can potentially, possibly delineate a Lancet One Health Commission from other commissions that were ongoing. And then Richard Horton usually gives you the okay. So commissions are commissioned. And then we were ready. We kicked off in 2019, right? But then the pandemic came, and we had to pause. Anyway, this just shows that, of course, there is always an ecosystem. And although when we started, One Health was not super at the forefront, right? It was there already. Planetary health was more the platform to go, the advocacy group. And so One Health was a science, or not a science, an approach that was mainly used by veterinarians. It was more about zoonosis and transmission of diseases from animal to humans. And that started, actually, that concept is very old already in the 1900s. Rudolf Virchow and William Osler, names that may ring bells with you as well, already talked about that interface, that connection between humans and animals and humans, animals and non-human animals in a way. So you can call it, there are different ways of narratives as well to express that we are not so different from one another. And that was still animals, humans, humans, animals. And then there was the first SARS outbreak that sensitized people. Then One Health, One World, another slogan that was actually supported or more pushed for by the Wildlife Conservation Society. And then what we just heard, the establishment of the Tripartite Alliance, which was WHO, FAO, and WOAH, which is the World Organization of Animal Health, then formerly called OIE. Anyway, so we had, throughout the journey until then we came on the agenda in 2019, there had been previous happenings. And we launched in 2019, then there was thought leadership from other publications. We had our first publication. There was a Lancet series of One Health in between a little bit later on. OLAP, the One Health High-Level Expert Panel we just heard from my colleague, was launched in 2021. And then the Quadripartite, and that was seminal because for the first time, the environment came into that human, animal, animal, human, and of course, agriculture and food was also represented by FAO. But the UNEP came in and created that Quadripartite. So that was really seminal. And then, of course, the negotiations started around the pandemic agreement. And I will not delay us any further. And of course, now we are hopefully very close, and hopefully this time it will not be delayed again. Our publication date is now next week on the 17th, hopefully. And I just pass back to you because I could talk a lot about this.
No, that's fantastic, and it's great to get the story so far. And thank you for letting us know that next week is the big day where you'll give birth to this report. So we're all on tenterhooks, really. And Professor Amuasi, maybe I can ask you to give us a glimpse. What are you going to be telling us, and what's going to be new, given the long history of One Health since the 1800s?
No, thank you very much for that, and once again, a great pleasure to be here this evening. We are really excited about the launch of the Commission's report, which will be next week. Well, you may call it giving birth, but maybe it's more of an outdooring. Where I come from, we have elaborate outdooring ceremonies for babies. So we've been giving birth since, 2019? Finally, the baby is out, so it's time to show the baby to the world. And so if you really want to read the report, you can't wait for it, then stay up at 11:59 BST on Tuesday night. The report will finally be available on the Lancet website, and you can read the full, how many pages, 60-something odd pages, I believe. But then on the 17th, a 13-hour CET, we'll have the formal launch, and you're all invited to that. The links will be available to those of you who want to join. Now, just to introduce you a little bit to the Commission and some of what we've done over the years since 2019, this just gives you a bit of an outline of the report and tells you what we get into. In a bit, I'm sure if we have the opportunity, Andrea will speak to things we may have loved to do in the report, but maybe we couldn't cover. Obviously, One Health is so deep and so wide that it's hard to say that in a report like this would cover everything. But we try to extricate what is really important, what we think is really important in One Health. We had about 22 commissioners from across the world, different ideas, different thoughts. We try and consolidate this to focus it a bit. And the interesting thing is that we don't, I shouldn't say we don't differ, but we don't disagree with anything that OLEP put forward. If for anything at all, we re-emphasize all of the points that OLEP has brought up and also suggests other areas that really need to be looked at if we want to capture One Health in a holistic manner. In fact, in our work, we did come up with a beautiful, not big beautiful, only beautiful definition. It could be big also, right? Anyway, the definition of One Health. I'm trying to be naughty here. But then when the OLEP definition came up, we said to ourselves, well, we'll shelve our definition because it doesn't deviate in any way from what OLEP had. And we strongly endorse and push the OLEP definition of One Health. I think it's amazing that we managed to come together as a community and have one agreed upon definition for One Health. This, I think, was a very critical foundation. But this is a little bit of what we have in our report. And we deliberately move away from your classic Venn diagram approach to describing One Health. You can see clearly that OLEP also does this, although in a different way. But we try and encapsulate One Health within what we say are the ethos. These ethos are what you can see, that the holism, systems thinking, epistemological pluralism, equity and egalitarianism, and then stewardship and sustainability. We think this is critical. This is the way of thinking. This is the way we bring ourselves into it. If the ethos is not shared, we have no business doing things together. And so establishing this ethos is so critical to being able to do One Health. In fact, if there is no ethos, it wouldn't have been possible for the pandemic agreement to have been agreed upon. Of course, some took themselves out of it, but hopefully they may come in at some later point. We're very hopeful because we really all need to be in this together. And we say that in order to execute One Health, you need certain key avenues, channels through which you would engage in One Health. And these are the knowledge, the governance, and the financing. You can't do without the money, of course, but where do we get the money from? Who controls the money? Where should the money go? Innovative financing mechanisms. One of the arguments that we put forward is that One Health in itself, if you unpack it, you would conclude that it is antithetical to the current global financing or financial system in every sense of the word. We measure growth in terms of GDP. If you really want to be true to One Health, GDP will not be the metric that you would use to measure progress, clearly. But we are in this together. We live in this together. How do we shift? How do we make that radical change, which cannot be fast? It will have to be slow. But we need to, first of all, agree that we need to make these changes. The knowledge, ways of knowing. How do we get to know? How do we accept what is knowledge? This is really critical in One Health, different ways of knowing, and then setting up a governance structure. We have the Quadripartite, but the question is, when you think of One Health, where will it sit? I heard a colleague from the FAO, and I saw that she tried to slip it in very nicely, and she's very proud. We now have the chair. That's FAO, okay? And I could sense the pride. Okay, so but who finally becomes responsible for prosecuting that One Health governance agenda? At some point, there have to be a decision around this. How do we do this? Very critical. I could go on and on. Unfortunately, there's a bit of distortion, different versions of Windows and all that. It happens. But we have 10 recommendations. I'm not going to go through these recommendations. It's just to whet your appetite. I give you, and you can call these the 10 One Health commandments or whatever you want to call them. It's fine. Oh, goodness me, this is a total distortion. Let me see. Oh, it's not very good, unfortunately. Now, this is what happens with different versions of PowerPoint, but I don't know if you can make make some sense out of the alphabets there. But this is just a sneak peek, a little bit of information into some of the recommendations that we have for One Health. I've been speaking for a long time, so maybe I will take a short break and then we could maybe come back.
Well, I will come back to you
very well.
about the pandemic agreement, but maybe first, to give you a little bit of time to breathe, I will go back to Professor Winkler and ask, One Health approach has not been without its critics. And some of the criticisms of One Health, whether you agree with them or not, is that it's still too narrow somehow. And that's changed. We saw the inclusion of UNEP and the environment side playing much more of an active role. But should One Health be broadened? And does the Lancet Commission report address this?
Yeah, very good question, Katie. And indeed, you are right. It has been criticized for being rather narrow. And this is also what I said before, very much human-animal, animal-human interface. However, it's not a bad thing in specific situations to be narrow. For example, when we talk about rabies control, it's actually quite good to be rather narrow and have those narrow interfaces and then pitch to the stakeholders and decision makers around that space. But that being said, I think the concept now has really broadened and has become more of an approach, even more of a working or life approach in general, where One Health doesn't sit at interfaces anymore, but surrounds activities, surrounds projects, approaches, perspectives, meaning equity, interdisciplinarity, cross-sectorality, systems approach being at the heart of whatever we do, think, implement. And of course, I mean, then it becomes a philosophy and it may not become anything anymore, right? So also in terms of terminology, what is important is that all of us, be it planetary health, One Health, eco-health, I mean, there are so many different healths that we all acknowledge that we move in one space. We have one planet Earth, we have one environment, built and unbuilt. There are changes going on, major transformations going at the moment, and we need to consider equity, other disciplines, sectors, and have that joint agenda setting. And then look for the added value that this joint agenda setting can bring about, collaborations in different forms and shapes. Maybe this is a bit too abstract, but one concrete example how we broadened it in our commission was really bringing in entities, which so far hasn't been viewed with the One Health approach, but there's so much, especially on the environmental angle, also with the animal health angle, especially now in mental diseases or for mental health, as we heard just before this session. So we have to broaden it, let in other diseases, disorders, or health perspectives. We also would like to apply to health systems. Overall, this will also be covered by the report, and prevention, risk factor monitoring, surveillance, you name it. So moving a bit away from the mere infectious angle. However, that being said, infectious disease is still super important, and of course AMR is also at the core of our commission. Thank you.
Thank you, and I like that idea of keeping that laser focus around those three objectives around animal health, human health, and environmental health. However, One Health being a broader mindset shift that can also be applied to many other aspects of global health, in fact, and beyond global health, of course. So embracing that complexity, looking at the systems thinking approaches, these are all things that can be carried over and are quite useful. Turning back to you, Professor Amuasi, and there were lots of roadblocks in your curve. Not least the COVID-19 pandemic, which led to revealing massive failures in our systems across the world. Now we have the pandemic agreement. It's been mentioned several times already in this session. It has an agreement. We have many additions or appendices still under negotiation. A lot of hurdles still in the way. What might this report bring to the implementation of the pandemic agreement when we get there?
Thanks for that question. And I must say, the pandemic agreement is really an exciting period, or shall I say event and period that we live in. And a colleague from the Federal Ministry really put it right that it was very difficult in coming. It's easy to think about what we wanted versus what we got. But the question is always, it could have been much worse, and that's the truth. It really got very tense at various points. And what we have now, is that something that can be taken forward to achieve some good? And for me, the answer is yes. So in as much as we may have some angst over everything that we thought it would be and it didn't turn out to be, the question is, this is what we have. And it is, I think, a viable starting point to achieve a lot more. I think about it this way with regards to One Health. In the putting forward the Sustainable Development Goals, there was no mention of the word One Health at all. Didn't exist. It doesn't exist in the SDGs. Surprise, surprise. You wonder, what were we thinking? Anyway, we can't answer that. And then even when there was discussion around accelerators to the SDGs, you recall, Andrea, how we painfully tried to lobby to get One Health listed as an accelerator, and we failed. It was not possible. And now, all of a sudden, One Health is the central theme of nothing other than the second legally binding instrument of the WHO. This is really amazing. And this is all precipitated by COVID-19 and the global experience that we had. It was not about papers and debating the evidence and so on. We lived it. We saw it. Everybody recognizes that there is this fundamental interconnectedness, not only of human beings across the world, because these pathogens don't require passports and so on, but then with other species, and then the environment which we share. So it made total sense to everyone to have One Health as the central theme or the central driver. So the question would be, how can this Lancet One Health Commission report play a role in prosecuting the agenda of the WHO pandemic agreement? And I would say, first of all, you can see in that schematic, it would support innovation and future preparedness. We explain how future investments in R&D could be pursued and why we need alternative approaches to promoting R&D. Clearly aligns with the pandemic agreement's goals. And it's interesting, we were writing the Commission's report and the WHO pandemic agreement activities were going on more or less in parallel. But it's interesting how they sound very much the same note, and the Lancet One Health Commission, I believe, to a large extent, will amplify the tone of the WHO pandemic agreement and its One Health provisions. We encourage inclusive action. We make it very clear that different ways of knowing need to be taken into consideration in informing scientific knowledge. We provide very practical tools in the report, and we show where we have tools that are missing, particularly in the area of metrics. If we're going to be prosecuting this pandemic agreement, we need to measure activity, we need to monitor progress. As yet, we do not have globally agreed upon One Health metrics, and this is one issue that we need to address. Of course, we speak about how it guides One Health integration, and we talk about supporting multi-sector collaboration at both global and national levels, and Andrea touched on this quite a bit. And we also believe that the report can significantly inform the crafting of the appendices. We are academics, and we engage at different levels, and we have, together with our colleagues, produced this report. We are hopeful that it will be taken on by the policymakers. We are doing our best to provide information in different ways, shapes, and forms, including being at a forum like this, thankfully, so that the information on the report can go far. It can get into some of these boardrooms and discussions and inform how the appendices are developed. I think the PABs are such a critical appendix, And I believe the report can provide some guidance as to how this can be done. And once again, I'll regress to this ethical and conceptual framework, the ethos thereof. We once again highlight the need for a shared ethos. Unfortunately, globally, there has been some kind of shift and concerns around what is important to everyone. I believe that at the core, we all know and believe in what is important to everyone. The challenge is understanding what the facts are. This fact about being fundamentally interconnected, it is what we are inextricably linked. It's not something you can do away with. It's just a fact. But if people are able to understand this, and hopefully the report provides this information, it automatically changes the way in which we think about things, and then also the way in which we would do things. So I think being able to provide this evidence of fundamental interconnectedness will then trigger agreement on the ethos, and therefore the way forward will be a lot clearer, and we hope that the report is going to support in doing this.
Thank you so much. We've come to the end of our 20 minutes. Unfortunately, we could talk about this for a long time yet. But maybe just to close up, what's next? Any final?
It's summarized in that slide in a way. There will be an afterlife, and as John just mentioned, I mean, it was totally impossible to cover everything. So there will be a bit more discussion and publication, most likely around the pandemic agreement. One Health surveillance also needs to be broadened, including the risk factor surveillance, including non-communicable diseases, and I think we can leverage a lot from the infectious diseases. Urban One Health, we did not touch on this in the report, just no space. That is another gap that we hope to be able to fill. Then being a neurologist, brain health, and including psychiatric and neurological disorders, but brain health as a much larger concept should be viewed with a One Health lens, and definitely we will have a lot of work to do on this, and accidentally we have been now commissioned with another commission on global brain health, so definitely this commission will inform the new commission. Then the geopolitics, we heard about that. Wars, migration, environmental degradation that comes with it, another area where we need to do some work. Then intersectionality, gender, and there will be a piece actually on gender, women and gender, that will accompany the report, so next week, because that we did not approach in a way we would have liked to approach it. And as John mentioned, just to close the circle is really, we need good indicators, metrics, we need frameworks, we also need calculations on investment, on return on of our investments. And I know that FAO is working on this. So One Health needs to become measurable. It is not now, but it will be, hopefully, in the future. And before we close, I just need to throw out a word of thank you, because all of this, I mean, 6-7 years now, and the pandemic would not have been possible without funding. And quite a bit of funding came from Germany. The then Ministry of Education, Federal German Ministry of Education and Research supported us a lot. The University of Oslo supported us directly. Lots of in-kind support by your center, John, at Kumasi, KNUST. Of course, Technical University of Munich. And we're already starting to fill the gaps, and we're already living the afterlife. GIZ has funded us for the establishment of a platform for women and One Health, which has been going strong for over 2 years. So Ruth, thanks a lot, and that has leveraged another dimension of One Health. I'll stop here, because I could go on forever. And really heartfelt thank you to you again, John, and of course our core teams, and to you for moderating. Thank you.
Thank you.
Thanks to you, and just, yes. I think I will take this opportunity to get out of the way between you and the drinks, and I will just hand over to our dear Karina to take us to the next part.
Thank you very much. I'm the personified transition to the fun part of the evening, although I hope you have had fun all day anyway. I thank the speakers of the pre-launch of the Lancet Commission report on One Health very much. Andrea and John, Katie, Fairouz and Tania, thank you so much. I think now that you have seen the strategic recommendations from the One Health report, please feel free to continue discussing these results at your little tables over the next few minutes. A few formalities. Please fill in the evaluation. There is a little QR code in your badges. Before next Friday, the 18th of July, we would very much appreciate feedback. And as was mentioned this morning, there is another survey on the German federal government's global health strategy. And this closes next week on Thursday, the 17th. Please join us in making some comments on that. When you leave, please leave your badges at the bottom in a box. And I would kindly ask all of those who participated in the last panel and those that were in the larger support group to come together to take a picture. But before we do that, I would like to ask the team of the Secretariat of the Global Health Hub Germany to the front and ask all of you to toast to a hopefully interesting and successful Global Health Talk 2025. Where's the team of the Secretariat?